health information podcast produced by the Phoenix Seventh-day Adventist Church. My name is Adwoa Opoku-Boateng. I'm an endocrine surgeon and general surgeon practicing here in the greater Phoenix area. Today we're going to talk about some interesting facts regarding parathyroid disease. As you may know, the thyroid is a butterfly-shaped organ that sits in the front of the neck, and it helps regulate the rate at which your body functions. On the back surface of the thyroid gland, you have got 4 small glands called parathyroid glands. Para means is Latin for next to. The goal of those glands is to help regulate the calcium. Every single cell in your body requires calcium for you to function normally. That calcium that the cells use is carried by the blood. Those parathyroid glands function like a thermostat. The goal of that is to regulate the calcium. If you need more calcium in the bloodstream, those glands produce a hormone called parathyroid hormone. The goal of the parathyroid hormone is to increase the blood calcium. It does this by taking the calcium out of the bones to put it into the bloodstream. It helps you absorb it at the intestinal level with the help of vitamin D, and also helps you absorb it from the kidney level. Now, sometimes you can get a tumor on one or more of those glands. When that happens, the gland goes rogue. You have enough calcium that is in your bloodstream, but that gland continues to produce that hormone. As long as that hormone is being produced in the bloodstream, you will continue to increase the blood calcium level. You'll continue to take the calcium out of the bones. You will continue to absorb it at the kidney level, and you will also continue to absorb it at the intestinal level. In the long term, this can cause severe problems. It can cause problems such as bone loss, osteopenia, osteoporosis, which can cause symptoms. It can cause kidney stones or renal failure in the long term. It can also produce symptoms such as constipation. There are some neuropsych symptoms such as fatigue, irritability, short-term memory loss that can also be associated with uncontrolled hypercalcemia. Now, most people with this condition called primary hyperparathyroidism will have just one gland that's causing the problem. That happens about 80% of the time. The other 20% of the time, you may have one or more glands. Who is at risk to have this problem? Well, it's almost twice as likely to be present in females over the age of 65. There is an association with a family history. Now, while this is true, most cases are actually sporadic. Also, hyperparathyroidism can be a result of using the medication lithium in the long term. If you have hypercalcemia and you present to the doctor, there are some things that they will do to look for this. They will check your bone density level. They will see how strong your bones are. They will also check a 24-hour urine collection. What this does is actually measure the amount of calcium that is being spilled into the urine. They will check some blood work. They will see what your blood calcium levels are and see if they are in the normal range or ranging too high. If you are diagnosed with primary hyperparathyroidism, there are some indications that we would recommend surgery. There is no medication to cure you of this, but there are some medications that can temporarily lower your blood calcium level in preparation for surgery. In addition, there are some times that patients are not really healthy enough for surgery, and in that instance, medication may be the source of control for that hyperparathyroidism or hypercalcemia. The indications for surgery in primary hyperparathyroidism are going to be osteoporosis or severe osteopenia, kidney failure with a decreased GFR, age less than 50, a calcium level that's as high as a calcium level that's ever been 12 or 1 milligram per deciliter above the upper limits of normal. Also, there may be an indication for surgery if someone does not want to undergo surveillance or watchful waiting. Hyperparathyroidism is a very treatable disease. In the right hands, this can be very curable. It is important that as a patient, you advocate for yourself and discuss this with your physician if you are concerned about it. They will ensure that you get to the right specialist to make sure that you are taken care of. Thank you for tuning in to Your Health today. It was a pleasure to discuss interesting facts regarding hyperparathyroidism. See you again next time.